Hello, everyone. Welcome from wherever you're watching. So excited to welcome you all here from around the world for the UNFPA Supplies Partnership Global Launch, Uniting to Accelerate Reproductive Health for All by 2030. I'm really excited to be your host today. My name is Janet Mbogwa. I'm from Kenya. I'm an author. I'm a media personality. And I'm the founder of the Inua Dada Foundation, which sheds light and focus on reproductive health and rights for girls and women in Kenya. So this for me is passion, and I'm excited about such progressive conversations taking place around the world. Now, before I introduce our speakers, keynote speakers, and some of our panelists later on, please allow me to make a few remarks and some suggestions for you as well, just to ease us into this very important partnership launch. The first one is interpretation instructions, and allow me to read for you. We say that there is a live French interpretation. If you'd like to utilize this function, please move your cursor over the Zoom screen and click on the globe in the bottom right of the corner. And in case you missed that, please make a suggestion in the chat box, and one of our incredible colleagues will be able to assist you to make sure that you're hearing this launch event loud and clear. A polite disclaimer, if I may. In the spirit of hearing everyone's voices in this very crucial launch, the diversity and inclusion that you will see represented in all our keynote speakers today is so important and imperative. And because we have a pretty short amount of time to make these powerful remarks, I would like to ask our speakers to please stick within the time frame given. And if you do go a little overboard, allow me to politely nudge you. I say polite, so that we can move along and make sure that we hear from everyone as much as possible. I think that's so critical that we get that all out. And so before we hear from our first speaker, a little overview of what this event is today. It is the only United Nations program dedicated to family planning, that is UNFPA. And it was launched in 2007. And this program has already mobilized $1.8 billion and is now the world's largest donator of donated contraceptives, really reaching those who don't have access. And we'll hear from some of them a little later on. Something that's also very close to me is how do we get that access there? And so this, like I mentioned in the beginning, so incredibly important that it's pushing the partnership element and access as well. And after 2 years of consultation with partners, many of whom will be joining us today, here is now the launch of the program, which is the UNFPA Supplies Partnership. And it's just the beginning of a conversation that is going to hopefully scale and continue to reach as many adolescents, girls and women who truly, truly need access to contraceptives, especially given COVID, and I know we'll hear a little bit about that at some point, but the onset of the pandemic has created what is being described as another shadow pandemic. And it's unfortunate that a lot of it is linked to lack of access to contraceptives. And with those few remarks, I would now like to invite our first keynote speaker, Dr. Natalia Kanem. She is the Executive Director of the United Nations Population Fund, UNFPA, the UN's Sexual and Reproductive Health Agency. I'd like to now invite Dr. Natalia Kanem to give us a few remarks before I then engage her in a question and answer session before we move on to our next keynote speaker. Dr. Natalia Kanem, please welcome to today's session. Be prepared to turn on your webcam and please address us all. Thank you.
Well, thank you so much, Janet. Excellencies, distinguished delegates, civil society leaders, partners, young people, friends. We gather in this virtual space together with the governments of Canada and Rwanda, and we mark the global launch of the UNFPA Supplies Partnership. This is the third and the most crucial phase of UNFPA's flagship thematic fund. We know that studies clearly show that investments, especially in adolescent girls today, will determine what our world will look like in the year 2030, when the Sustainable Development Goals come due. On the way to 2030, will every adolescent girl have the information and the services that she needs so that she can graduate from school? Will she have the power and the agency to delay marriage, to choose when, with whom, and whether to become pregnant, to raise a family, protect her health, and earn a decent living? The global COVID pandemic underscores just how tenuous her ability to thrive is. In Kenya, where school closures are preventing girls from accessing free menstrual hygiene products. Some are forced to resort to transactional sex to cover their basic needs. There has been a rise in sexual violence there, like everywhere else in the world, all contributing to a spike in teenage pregnancy. In Haiti, pregnant women are fearful of contracting coronavirus, so they have stopped seeking their access to care, leading to an increase in pregnancy complications and even death. We at UNFPA estimate that 13 million women and girls in Latin America and the Caribbean will lack access to contraception, and this could potentially roll back the progress of family planning 20 to 30 years. All over the world, women and girls are experiencing a shadow pandemic of sexual and gender-based violence, of female genital mutilation, early and forced marriages, and other harmful practices. So let me be clear. All of the progress that we've made in recent decades is at stake, all of it. Together with our partners, UNFPA is racing to adapt to this new reality. Our fierce determination is reflected in the vision of the UNFPA Supplies Partnership. We want to transform lives by giving people greater access to quality reproductive health supplies whenever and wherever they want or need them. And to do so, we have to pool the best of our energies, our resources, our talent into invigorating this. Our partnership has to support the best country-led efforts to transform women's lives. And we're fortunate because we have strong success stories, we have proven strategies, we're increasing contraceptive choice and autonomy. For example, by introducing the subcutaneous, under the skin, injectable contraceptive to more than 40 countries. Investments in logistics. Now, even with COVID, logistics management has to be strengthened. These supply chains are the backbone of any health system. Mozambique, for example, has scaled up its computerized logistics management for reproductive health supplies from earlier on 157 facilities to over 1,000. That's just in 2 years. Going the last mile takes extra commitment. We saw this commitment in the Democratic Republic of Congo last year when 2 hard-to-reach regions achieved 100% coverage for family planning services. Now, new domestic financing is coming in Benin, in Burkina Faso, Cote d'Ivoire, Mali, Niger, and Togo. This has been met with a matching $5 million through the UNFPA Supplies Ouagadougou Partnership Commodity Matching Fund. Innovation, an initiative that creates an incentive to boost domestic resources for family planning. Let me also say, as we meet today from all our respective parts of the world, that I too share in the uncertainty, the isolation, the grief of this COVID-19 era experience. Yet, we must recognize, as UNFPA certainly does, that in this difficult time, it is the poorest women and girls who are remaining, as ever, the most vulnerable. Look, just over a year ago, nearly 10,000 strong, the Nairobi Summit celebrated 25 years since the Cairo International Conference on Population and Development. That ICPD agenda is evergreen because it puts the right to plan one's family at the very heart of development. In the decades since, we've seen a shift in the global conversation. It's now widely recognized that access to sexual and reproductive health and rights, including family planning, is key to achieve gender equality and to improve the quality of life for women and girls, but also for everyone. Millions of women and girls are leading healthier, more enriching lives as a result. And yet today, why is it that 217 million women who want to avoid pregnancy still don't have access to modern contraceptives? And we are falling behind on the targets to reduce maternal deaths. In Nairobi at that summit, we committed We committed to doing everything in our power to change this. And now we must carry through and deliver on our promises, and COVID cannot be an excuse. Since 2007, UNFPA Supplies has been there. We've been working to realize the transformation that we want to see. The program has mobilized a remarkable 1.8 billion US dollars to date, providing quality contraception and maternal health medicines while also supporting countries to strengthen their health systems so that women, couples, young people can access no matter where they live. This partnership, UNFPA Supplies Partnership, embodies our shared goals envisioned in that Agenda 2030, and it helps pave the way towards universal health coverage. Today, right now, we have a unique opportunity. We can move this vision forward with renewed energy, and we must. The most marginalized women and girls must not wait any longer. As we lay the foundation for the work ahead, I express my heartfelt appreciation to Canada, Rwanda, UK, others, donors providing core financing, and everyone who joins us in this new partnership. The road ahead may be steep, yet we have the advantage. As the proverb says, starting out early makes the road short. Rising together, we make that road shorter. I remain optimistic that with our collective action now, we can surmount whatever challenge lies ahead and protect the women and girls who are depending upon us. Thank you so much.
Dr. Khanum, thank you so much for those incredible remarks. A question, if you will, is really around the emphasis on partnerships, and why is there an emphasis on partnerships in the program's new name? What does this really mean?
Well, you know, Jenna, in UNFPA, we say it's teamwork that makes the dream work. Our ambitious dream is zero unmet need for family planning. To make that real by the year 2030, no one agency can do that on our own. We need all hands on deck. We need to be pulling in unison in the same direction. And the partnerships and what I believe is the superb collaboration, you know, I just spoke of, that's led to the success of this UNFPA Supplies Partnership to date, that's made possible by leadership, political will of countries, cooperation of civil society. There are a lot of very dedicated family planning organizations all around the world. And when I meet them, I'm excited. There are people that have been at this for decades, and they know that when we rally around a joint mission, it makes life so much better for people who otherwise would not have a choice. Yes, in Grandmother's Day, we had 12 and 15 children and what have you, but grandmother herself has said, this is one of the things that held her back. So whether it is a woman in a rural area or a woman in a city, she wants her rights to be respected, plain and simple. So who's making this progress? Well, the type of people I meet are health workers in a rural mountainous area, devoted, warehouse managers in a city, traditional leaders who have come out in support of women being able to space their children according to their wishes. These alliances of NGOs now are also being bolstered by young people and the policymakers, those parliamentarians who value the profound social and economic benefits of family planning. Look, I just want to thank this particular partnership because it's effective, it's science-based, and we have a lot of feedback from evaluation to show that it works. Now we've got to increase the momentum. For next year, I want to see more country compacts. I want to see better definition of roles and responsibilities. So much to do. So everybody take their piece and we back each other. I also am very much a believer in accountability. That's another success of this partnership. We know where the money is going and we expect full accountability. So this is a strong and deep partnership. And you know, that sustainable development goal for strong unity around partnerships. This is number 17. And I think women and adolescent girls can be confident that we're going to back them to access the voluntary contraception of their choice.
Dr. Natalia Khanum, thank you so much. I think so many people are resonating with the powerful words that you've spoken. We really appreciate you. Wish you all the best. I know this is a journey for all of us. So thank you so very much for your remarks.
Thank you, too.
All right. And so with those powerful remarks, which I believe are a call to action to each of us to play our part and hold policymakers accountable with regards to providing this access to girls and women around the world, we've heard that the UNFPA Supplies Partnership is evolving to meet these challenges and deepen engagement with partners to accelerate access to family planning. But how exactly will this be done? Please take a moment to watch this short video for an explanation on the same.
By 2030, this girl will become a young woman. To help her reach her full potential, we must guarantee she has reliable access to and availability of information, services, and supplies. UNFPA Supplies is dedicated to expanding access to family planning and maternal health for women and girls most in need. Our work has averted 89 million unintended pregnancies and 227,000 maternal deaths. A new phase takes us to 2030 as the UNFPA Supplies Partnership in order to deliver transformative results with countries in the lead. Each country will have a compact with UNFPA that supports its family planning goals, outlining roles and responsibilities in the partnership. The partnership will work with countries to build capacity so they can move towards financing their family planning and reproductive health programs on their own. A new participatory governance structure enables the partnership to monitor performance, deliver on goals, and be more accountable to those it serves. By tailoring the approach for each country, the partnership is able to maximize the impact of its resources. Countries receive support from the UNFPA Supplies Partnership through 3 funding streams. Supplies funds a range of contraceptives and maternal medicines, including for humanitarian crises. Transformative Action Funding strengthens supply chains, improves policy, and introduces new contraceptive methods. The Performance Fund ensures effective and efficient use of resources. To fully realize these pivotal shifts, the UNFPA Supplies Partnership must secure $2.5 billion by 2030. Together, we have the potential to prevent 141 million unintended pregnancies and avert 328,000 maternal deaths by 2030. Join us in transforming our world into one where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled.
And there we have it, just a little bit of an explanation on exactly how this partnership program will work, and just a disclaimer there, an emphasis on the fact that we can do more because it will prevent 141 million unintended pregnancies. An incredible video there. I'd now like to turn to our co-hosts, beginning with Rwanda. Rwanda, which has been a UNFPA supplies-focused country since the program began. And I'd like to invite His Excellency Dr. Daniel Ngamije, Minister for Health, Republic of Rwanda, to tell us more about progress and ongoing challenges in this video recording.
Her Excellency Dr. Natalia Khanum, the UNFPA Executive Director, Her Excellency Karine Gould, Minister of International Development, Canada, distinguished speakers and participants, all protocol observed. On behalf of the government of Rwanda, I would like to express my gratitude to UNFPA for choosing Rwanda to co-host this global launch of the redesigned UNFPA Supplies Partnership along with the government of Canada. This global launch comes at the opportune time where the country is celebrating good progress in family planning, according to the recent 2020 Rwanda Demographic Health Survey findings. The modern contraceptive prevalence rate changed from 47.5% in 2014 to 58% in 2019. And the unmet need for family planning moved from 19% to 14% in the same period. We acknowledge continued support from partners, including UNFPA, through availing needed commodities, including contraceptive, supply chain management, health system strengthening, policy development, among others. Moving ahead to the new decade, we need to keep the momentum and move ahead to reach those whose needs are still not met and leaving no one behind, especially in this period where the pandemic of COVID-19 is posing various challenges. We welcome the new strategy of UNFPA Supplies with country at the core, anchored through the compact, and we are very thankful to the previous support that enabled us to reach where we are today. The challenge of population dynamics with respect to the sustainability will play a profound role in shaping the future of the global economy in all countries, particularly in Rwanda, where the largest Rwanda population is young. There is a need to invest in them, giving them value of girls' education, and the need for services, equity, and social justice to allow them being productive toward the sustainable development. We know what are the needs and what to be done to realize a world of rights and choices for all. Adequate funding, effective conducive policies and laws, and political commitment are critical to success. As the world grapples for new challenges and changing financial landscape, financial sustainability for SRH family planning commodities remain central to ensure the gains made are not lost. Rwanda has developed a business case for family planning which illustrates the huge benefits of investing in family planning, the gains of which go beyond the health sector. For the case of Rwanda, the study revealed that every single dollar invested in family planning could yield $112 in return between 2015 and 2050. Key sectors benefiting from this return on investment include education, agriculture, the economy. In addition, increased budgetary allocation to health, including family planning, is one of Rwanda's commitments on ICPD 25, and we urge all partners to also prioritize budgetary allocation to family planning and programs such as the UNFPA Supply to ensure availability of commodities to those who need them when they need them. The government of Rwanda is committed to the Family Planning 2020 objective in 2012 and has renewed its commitment in 2017. Since then, we have identified and high-impact intervention, which are introduction of new method, postpartum family planning, and community-based provision of contraceptive. We recently committed for ICPD 25 toward universal sexual reproductive health. I'm optimistic that this redesigned program will be a catalyzer of a global compact transformational partnership to develop new innovative strategies, spurring increased accountability towards the well-being of the global population. In closing, I wish to express my gratitude for the new partnership and commitment from partners throughout our journey towards Rwanda Vision 2050 of the Rwanda we want. I thank you so much.
And we thank you, His Excellency Dr. Daniel Ngamije, Minister of Health, Republic of Rwanda, for those remarks. Now, we have heard from Dr. Natalia Kanema as well earlier on about just how affected girls and women have been during COVID-19 with the shadow pandemic, many of them, whether it's FGM, child marriage, period poverty, or menstrual inequality. And so while we are in the presence of this global launch, this partnerships launch, which is so imperative, what about the girls and women who've chosen to go the contraceptives route? What does it mean for them? Let's hear from some of them.
J'ai 20 ans, je fais la terminale, j'ai un fils et je préfère l'autre le jardin pour la planification familiale et continuer mes études.
Je suis une élève de 3e. Je suis à la maison avec mes parents, mais je fais une enfant. Je vais encore commencer mon école. C'est pour ça que j'ai fait planning.
It's not easy managing studies, home issues, business, sometimes family. It's hectic, but I'm in for it. And the reason why I've chosen family planning just to help with effective running of my business as well as effective studies. But when I have it, I know I'm totally safe. I can study up to where I want to go. And when I feel that it's done, I can remove it. That's why I've chosen it. Without family planning, there's no way you can manage it.
मेरो पहिलो बच्चा पनि भयो अनि दोस्रो नानी जन्मियो अनि सन्तानको रहर पुग्यो मेरो सन्तानको रहर पुगिसकेपछि चिन्ता भयो के मलाई अब के साधन प्रयोग गर्ने होला जस्तो कि अब मैले स्कुलमा पढाउन सक्छु इम्प्लान्ट राखे अनि राखिसकेपछि अब मजाले ढुक्क साथ मैले बच्चाबच्चीको स्याहार सुसार अनि लगेर पढाइमा पनि राम्रोसँग पढाउन सक्छु बच्चाबच्ची हुर्काउन सक्छु जस्तो लागिरहेछ मेरो जुन बच्चा छ तिनीहरुको उज्जवल भविष्य हेर्न चाहन्छु सायद यसले सहयोग गर्छ जस्तो लागिरहेछ
And there we have so many reasons why a lot of the girls and women have and embraced family planning for effective planning for their studies. Those are the reasons, and that's why this global launch event is so important. Let's now move on to our next co-host. And I'd now like to introduce our co-host from Canada. They've been a very key donor to the UNFPA Supplies since 2017. And it's my pleasure to invite Her Excellency Kamal Khera, Parliamentary Secretary to the Minister of International Development, Canada, to tell us more about why the program is so important before I engage her in a question or two. Her Excellency, thank you for joining us and please share your remarks.
Thank you, Janet. And I'd also like to thank my co-host, Dr. Natalia, Kadam, and Minister Gamije. I'm extremely glad to be here today with such an engaged and active groups of countries, donors, and stakeholders. Together, we are facing one of the worst crises of public health in modern history. This COVID pandemic has pushed public health systems to the brink, intensified inequalities, and has led dire secondary consequences for women and adolescent girls confronting discrimination and exclusion. Lockdown measures have led to major disruptions in essential services for sexual and reproductive health and rights, leaving women and girls around the world isolated with their bodily autonomy undermined. We know that over 1.9 million women have already lost access to contraception and safe abortion services. We're here together because we are committed to doing more. We must work together to support these women and girls doing whatever it takes to reinforce their autonomy and to prevent decades of gains being rolled back by this pandemic. But how? So first, we need rights-based family planning services. We need affordable, quality contraception options for all and stronger supply chains to ensure their availability. And we need comprehensive sexual education and coordinated advocacy. After collaborating with UNFPA for over 40 years, we know well that it has led the charge to tackle these issues. Along with the commitment of sustainability and country ownership, including strengthening supply chain to the last mile, the UNFPA Supplies Partnership supports SRHR service delivery by helping to ensure consistent and reliable access to quality contraceptives and maternal health medicines. The support provided by Canada to the UNFPA reflects our feminist international assistance policy because this is ultimately about empowerment. We are extremely pleased to see UNFPA putting the rights, agency, and autonomy of women and girls in all of their diversity at the center of the next phase of the Supplies Partnership. A key component of our feminist approach is a commitment to reinforce and to maintain essential health services, and in particular, comprehensive SRHR services despite the pandemic. That's why I'm extremely happy to answer the call from the UNFPA Supplies COVID-19 Response Appeal and commit $14 million in immediate funding. I'm also honored to announce that Canada will be supporting the UNFPA Supplies Phase 3 partnership with an additional $25 million in support over the next 5 years. We know this funding will help mitigate some of these dire consequences I noted earlier, and also help build momentum for the partnership as it launches into the next phase. This next phase, Phase 3, marks an important step towards the UNFPA Supplies Partnership and is absolutely necessary as a global community takes stock of the impact of COVID-19 and charts the way forward to achieve sustainable development goals by 2030. We're extremely proud to have been supportive of this program to date and look forward to being part of this in the next phase of journey. Thank you.
Her Excellency, thank you so much for those remarks and for your commitment and for everything you're doing as well as a country to make this change and impact. A question for you. At a time of the unprecedented challenges that have come with COVID-19, particularly in already weak and fragile settings, how can we work to strengthen health systems while also meeting the most basic and urgent needs?
Thank you for that. Well, look, I think health system strengthening is a priority for Canada. When responding to those basic urgent needs that arise because of the pandemic, especially for SRHR, we must also identify areas that both strengthen and the areas that weaken within the health systems. Where do things break down? What innovations can we institutionalize? These lessons will be critical to create a stronger foundation for the future. That's why we're engaging with experienced partners, including the UNFPA Supplies, with a longer-term vision to support countries to build stronger, more resilient health systems, supply chains, and to ensure the continuity of essential services, particularly for SRHR. We must also take advantage of the innovations that has spurred by this pandemic. We've seen changes that the SRHR community has been calling on for years to take place overnight, which are steps towards putting control of their bodies back into the woman's hands. These includes, widening access to information and referrals through telehealth services, providing increased access to medical abortion pills where legal, and increased supplies of antiretrovirals from 1 to 3 months for those living with HIV/AIDS. These show us how we can make our systems more nimbler, client-focused, but at the same time, we must build on the positive momentum to find new solutions for women and girls and others who too often face exclusion and marginalization from the current approaches.
Her Excellency, thank you so much for shedding light on that. It really is quite a shift and a turning point, and we hope to see that progress even more. Many thanks for your remarks, Her Excellency, and we look forward to you joining us for the rest of this session.
Thank you.
So a very big thank you to all of our speakers, all of our keynote speakers who've raised some really important points there and shed light on what's happening in light of COVID and how that, in a sense, has still spurred the change that was needed from such a long time ago to shed focus on access to contraceptives and family planning methods, as well as reproductive health and rights for girls and women around the world. And I'd also like to take this opportunity to invite those of you who are watching this launch event from around the world to share your thoughts or questions in the chat box. We'll be able to, hopefully, time allowing, share some of your thoughts and feedback. I can already see some of you are sharing that. So please do join the chat, share your views, share your thoughts, and we should be able to hopefully highlight one or two a little later. Also, please include your home country and what inspires you to be part of the UNFPA Supplies Partnership. Do tell us in the chat box. We'd really like to read that if we're able to. Now let's hear from some of the valued partners joining together to make this all possible in this video. Next.
The government of Sierra Leone cherishes the long-standing partnership with UNFPA. This partnership has contributed to tremendous improvements in some of the key health indicators, such that in the last 5 years, 2013 to 2019, we have seen a 25% reduction in teenage pregnancy. We have also witnessed a 40% reduction in maternal mortality ratio. The proportion of maternal deaths now that are contributed or attributed to adolescents have reduced by 50%. We could not have achieved all of this without reproductive health commodity security. Therefore, UNFPA Supplies and their programs has had critical interaction with Sierra Leone's health sector recovery plan. We in Sierra Leone appreciate the renewed commitment of all our partners to ensure access and the utilization of life-saving reproductive health commodities.
We believe in the power of UNFPA Supplies Partnership as it charts its course for the next 10 years with a clear emphasis on the availability and choice of quality assured commodities, strengthened supply chains, and increased government commitment. UNFPA and UNFPA Supplies have been key to the success of FP 2020 and will be equally critical to our success in the next decade.
I really think that getting the buy-in from such a wide pool of donors for a 10-year period is a real success for our community. It will allow us all to build sustainable structures in securing access to key commodities like contraceptives, safe abortion supplies, and maternal health medicines. It goes without saying that UNFPA Supplies has become IPPF's most important partner in securing access to those life-saving commodities. We are therefore delighted to see that the program will expand and be rolled out in even a higher number of countries in phase 3 of the program. Let's get it done, guys.
The government of the Lao People Democratic Republic has been a long-standing partner of UNFPA. UNFPA Supply Program contributed to the development of the first national comprehensive family planning training package that offer technical information to healthcare providers, deliver family planning services appropriately and effectively. UNFPA Supply Program also contributed to improve efficiency of supply, supporting capacity building of health staff to manage and implement on M-Supply ELMIS system in nationwide. On behalf of the Lao government, I would like to welcome the launch of the new strategy. I am happy to see that it includes a new programmatic partnership that create the foundation for full implementation. We are glad to be part of this new dawn. We hope that the program will support our government to achieve our ICPD 25 commitment on ending unmet need for family planning and ending preventable maternal deaths.
For Denmark, UNF Supplies is one of the most effective ways to win the battleground in our fight for women's and girls' right to decide over their own bodies. A fight that is fought with supplies of contraceptive and life-saving maternal medicines. In addition to our annual contribution of approximately $18.4 million, Denmark has in 2020 committed approximately $3.3 million to UNFPA Supply as part of our international COVID-19 response. Denmark is proud to join forces with UNFPA Supplies to ensure a future where the fundamental rights to decide over your own body is not a privilege, but a right for all.
Thank you so much to Your Excellencies for your contribution, your partnership, and your commitment to providing access to contraceptives for girls and women, especially those in need around the world. We appreciate your commitments and we appreciate your momentum as well during this launch. Let's now hear from 5 more key partners, some of whom have been long supporters since the program began, some of whom have newly joined. Please allow me to introduce each of them back to back before we invite them one by one to share in their remarks. Our first key partner is Her Excellency Dr. Maria Flachbach, Parliamentary State Secretary, Federal Minister for Economic Cooperation and Development, Germany, followed by Yordanos Walde, Program Coordinator at Talent Youth Association, a youth-led organization working to address development issues, particularly enabling youth to realize their full potential with an active role in their own country's development. And then we have Her Excellency Kitty van der Heijden, Director General International Cooperation at Ministry of Foreign Affairs in the Netherlands. And then we have Her Excellency Wendy Morton, Minister for the European Neighborhood and the Americas, Foreign, Commonwealth and Development Office, United Kingdom. And finally, Dr. Griffins Odhiambo Manguro, CEO and Country Director, International Center for Reproductive Health Kenya, who's newly joined the UNFPA Supplies Partnership Steering Committee. Let's invite you all to please turn on your webcam and then invite you each one by one to share in your remarks. First of all, a very warm welcome to you all. Thank you for your continued support and partnership. Her Excellency Dr. Maria Thachbach, please commence with your remarks. Thank you.
Thank you very much, Janet. Executive Director Natalia Kanem, Excellencies, ladies and gentlemen, across the world, girls and women are hit particularly hard by COVID-19 pandemic. The countries of the Global South, we can see a significant decline in access to family planning. We are receiving figures on impacts from many countries. During the lockdown in the first half of the year, the number of the first-time users of combined hormonal contraceptives in Zimbabwe dropped by 90%. In Turkana region in Kenya, the number of teenage pregnancies has tripled. Only if girls and women have access to right-based family planning are they able to take decisions freely and in dignity about their lives and their future. Access to contraceptives is also vital in order to reduce the high number of abortions. It must always be possible for pregnancies to be planned and safe, especially in times of crisis. This is why Germany will support the UNFPA Supply Partnership for the first time with an amount of 2 million euros. UNFPA is an important partner for Germany in our effort to work for our common goal of ensuring access to essential sexual and reproductive health services. Since 2013, Germany has been one of the main contributors alongside with Sweden and Luxembourg to the Maternal Health Thematic Fund. In 2020, we are additionally contributing 2 million euros. And we are pleased that in these hard times, we were able not only to support UNFPA supplies, but also increase our core contributions to UNFPA, bringing them to 70 million euros. After all, we know that we can only beat COVID-19 together. Thank you.
Her Excellency, thank you so much for that commitment and those remarks. We truly appreciate that. I'd now like to invite Yordano Swalde to please give your brief remarks and commitments as well. Thank you.
Thank you, Janet, and thank you organizers for putting me up with fellow panelists with such a distinguished group. Throughout the years, we've had generational changes and variances. However, one thing remained, and that was the betterment of humanity. In this, we have learned to embrace the potential of young people, the innovation, the new perspective, and all in all, our growth. To ensure the present and our future young people continue on this legacy of growth, we need to be healthy, safe, and have access to services and supplies. Young people, especially adolescents, are still at a much higher risk of unintended pregnancies and maternal mortality. We are still a group that is so diverse with varying degrees of needs and challenges. However, having access to services, supplies, and a wide range of choices is still at a minimal and is a common challenge to us all. From the young boy that has never seen a condom to the young girl that is getting married off as a child, but doesn't even know that she can space out her pregnancies. We have work to do. The UNFPA Supplies Partnership can prevent the detrimental effects of losing such potential. We can prevent up to 141 million unintended pregnancies and over 328,000 maternal deaths over the next decade. So as an African, as a young woman, and as an advocate representing my peers, I would like to first say, Amasaganadlo, Murakoze, Asante Sana, Danke, Danke ver, and thank you. Because because of this partnership, there has been wonderful work that has been done for people like me. I would like to follow up, of course, with a call to action for us to work together in replenishing these efforts, to continue doing what we've been doing best, so that 10 years from now, maybe another young person can sit before you and thank you again. Thank you, Janet.
The voice of youth powerfully represented through you, Jordanos. Thank you so much for those incredibly bold remarks. I'd now like to invite Her Excellency Kitty van der Heijden, Director General, International Cooperation at the Ministry of Foreign Affairs, Netherlands. Her Excellency, please go ahead and make your remarks.
Thank you. And what can you say after such a powerful speech by the people we aim to serve, young people that don't have access? For us in the Netherlands, having access to reproductive health commodities and being able to decide if, when, and with whom you have children is a fundamental right. It's a fundamental human right. It's about bodily integrity and bodily autonomy of women anywhere in the world, young, old, no matter where you are. And of course, the UNFPA Supplies Partnership has been having a tremendous role in making sure that the products to do so are available to everyone. And that includes safe abortion. This is absolutely essential for gender equality. It's absolutely essential for young people to live the life that they want, that they need. We very strongly applaud in the new program that focus on partnerships and that focus on country level work. We believe that it's only if we work together with all the partners, be they NGOs, UN, WHO, the global health initiatives, only together we can achieve those SDGs. And the challenges now are bigger because of COVID-19. For us, it's equally important that we take the perspective of those we aim to serve when we start the program. It is about the people that need those products to make sure that we really reach that last mile, those left furthest behind. And therefore, we must put countries in the driver's seat. Look at the miracle that they've been able to achieve in Sierra Leone that was just referred to. Equally important, last 2 points, is that we put youth in the driver's seat, that we think of their specific needs. And I'm so pleased with the previous speaker who was so powerful. And in earlier videos, how much this enables young women to continue developing their life, to study, to reinforce their autonomy, bodily, but also socially, economically, politically. That's what we do with this program. So I'm proud, happy, and incredibly pleased to announce that we will support the continuation of this program with 50 million euros over the next 2 years. We will be monitoring the partnerships, the country level effectiveness of that work, and whether indeed we reach the last mile, because that is what the SDGs are about, to leave those, to make sure that no one is left behind. Thank you and good luck. Keep up the good work.
Her Excellency, thank you so much for that and for that generous contribution, which will no doubt go such a long way in ensuring that people are empowered, and girls and women especially. Thank you so much for that. Her Excellency Wendy Morton, Minister for the European Neighborhood and the Americas, Foreign, Commonwealth and Development Office, United Kingdom. Please share your remarks as well.
Thank you, Janet, and I'm absolutely delighted to be here with you all today representing the UK's Foreign, Commonwealth and Development Office. And thank you to our hosts, the UNFPA, Rwanda and Canada, for organising this important event. Fighting for gender equality is at the heart of the UK's work to end global poverty. We know that when women and girls are able to decide freely if and when they want to get pregnant, they are more likely to stay in school, enter the workforce and reach their potential. We also know that we cannot end preventable deaths of mothers, newborn babies and children without prioritising sexual and reproductive health and rights. Globally, over 800 women die from pregnancy or childbirth every single day. Many of these deaths could be prevented if hospitals and clinics had access to the right medicines, and if women and girls had access to voluntary family planning. That is why last year, the UK pledged £425 million to the UNFPA Supplies Partnership, an investment that will provide contraceptives and maternal health medicines to women and girls in the world's poorest countries. The UK is proud to be the largest donor to UNFPA supplies and of our role in helping to shape the direction of this programme. And now, as the partnership looks forward to a new strategic period, we are confident that UNFPA Supplies is ready to meet the challenges of the next decade. The programme's new approach to co-financing promises to better support countries on their journeys towards self-reliance. A sharpened focus on reaching women and girls in humanitarian settings will help to target resources towards those most in need. And a bolder mandate to expand access to safe abortion supplies will allow us to uphold our commitment to comprehensive sexual and reproductive health and rights. Now more than ever, we must step up our efforts to expand access to essential sexual and reproductive health services. The global pandemic threatens to reverse the gains of the last decade, and we know this will have a severe impact, including on girls' education. And so we're therefore calling on our partners to increase their contributions to the programme so that we can ensure women and girls are not left behind. We look forward to working with you all in partnership and to launching phase 3 of the programme. Thank you.
Your Excellency, thank you so very much for those remarks and your commitments as well. We appreciate them fully. And then finally, to invite Dr. Griffins Odhiambo Manguro, CEO, Country Director, International Center for Reproductive Health, Kenya. Doctor, to please make your remarks. Thank you.
Thank you very much, Janet, and good evening and good morning, ladies and gentlemen. And please receive a very warm greetings from Nairobi, and thanks to UNFPA, Rwanda, and Canada. For me, who's also a first-time member of the UNFPA Supplies Steering Committee, this is a really unique opportunity to join this committee. As a local NGO, we conduct research, we do interventions in sexual and reproductive health among marginalized communities, especially adolescent girls and young women, and also among marginalized communities such as female sex workers and other communities. One of the things I have to acknowledge in this new dispensation or in this new shift of government is that you've taken into consideration this new redesigned model that brings forth a shared decision-making process with mutual accountability, partnership, involvement of stakeholders at all levels, and in order to optimize program outcomes. Local NGOs and civil society organizations like ICRH are actually closest to the women and girls, especially those in marginalized areas. So as such, we really present the voices of those who are the eventual beneficiaries of the program inputs, and we are critical partners in reproductive health, including family planning. It's also very interesting that I am actually presenting this as a man, but obviously it's also good that it also shows the amount or the level of interest that the community in general has towards family planning and towards the outcomes for sexual and reproductive health, especially for young people. And I think this new involvement of civil society organizations in the UNFPA Supplies Committee really reflects the mantra of nothing for us without us. We really cannot have interventions, we can't have programs without the involvement of local communities and without the voices of local communities being heard. And thank you very much to UNFPA Steering Committee for having included civil society organizations and non-governmental organizations in the decision-making process and in accountability for family planning, supply chain management. Of course, this is bearing in mind that different countries have different goals and contexts, and it's good that this partnership acknowledges that. This partnership acknowledges that we need to work together and to ensure that all of our unique needs are met and all of our conditions are understood. So as such, most of civil society organizations like us bring forth an element, and we would support in devising solutions that meet the intended need, bearing in mind the local context, and at the same time ensuring that we maximize resources effectively. And we also bring forth that local ingenuity and the ability to really understand the national and subnational contexts. So we assure you as new members in the committee, we assure you that we will be loud, we will assure you that we will bring value, and that our membership really will be able to amplify the voices of the communities that we serve. So at this point, I'd like to really acknowledge, I'd really like to laud the efforts, the initiative from the UNFPA Supplies Partnership. I'd like to really thank the governments of Canada and the government of Rwanda in this inclusive and holistic approach of really including the voices of local non-governmental organizations and CSOs, and inviting us to the table in order to really amplify the voices of those that we serve. So mine is to say thank you very much, and to say that we will be loud, and we hope that we will be able to bring forth the kind of local and contextual understanding, and we would be able to bring value to the partnership. So thank you very much, and really we hope to have a very fruitful partnership.
Thank you so much for that, Odhiambo. And even as you mentioned, being a man, yes, the allyship of men is so critical in this journey as well. So thank you for speaking on behalf of all the other males in attendance. We thank you. We thank you so much, Your Excellencies, as well. Her Excellency Dr. Maria Flachbach from Germany. Jordanos, thank you so much for your remarks on behalf of young people, not just on the continent of Africa, but really voicing what many others definitely around the world who don't have access would be thinking. Her Excellency Kitty van der Heijden as well from the Netherlands, thank you for your remarks and your contributions. Her Excellency Wendy Morton, thank you so much as well for your remarks. And once again, Dr. Griffiths Odhiambo, we thank you. I mean, I've heard Kenya mentioned a few times, and for those of us on the ground here, it's definitely a shift happening, but so much more remains to be done, not just here, but other parts of the world. We thank you all so much for your commitment and contributions. Thank you. Here is a quick reminder again to all of you who are in attendance to talk a little bit more to each other in the chat box. I can see such incredible suggestions and thoughts and views coming up there. I don't know that we will be able to read them, but I hope that you'll be able to interact with those thoughts and views. And later on at the very end of this global launch, we'll be able to share more partnership videos for you to be able to see what many others are committing to and are doing. For now, though, it is my pleasure to invite the UN SG's envoy on youth, Her Excellency Jayatma Vikramanayake, United Nations Secretary General's envoy on youth, to share her remarks as we draw to a conclusion of this event. Her Excellency, please proceed.
Thank you very much. Greetings, everyone, Excellencies, dear colleagues from UNFPA and the UN more broadly, government representatives, donor community, civil society partners, and most importantly, my fellow young people around the world who are all here today, uniting to accelerate reproductive health for all by 2030. What an important moment this is for the present and the future of the world's largest generation of 1.8 billion young people. As the Nairobi statement highlights from last year, the future of sustainable development and the future of the ICPD agenda is directly linked to fulfilling the aspirations of adolescents and young people. Investing in their education, health, employment, and fulfillment of their rights will unleash their potential and will make the vision and the promise of the ICPD program of action and of the 2030 Agenda for Sustainable Development a reality. But there is a big but. Today, youth suffer the highest unintended pregnancy rates of any age group, and the COVID-19 pandemic will further exacerbate this situation. For example, adolescents in low and middle income countries have an estimated 21 million pregnancies each year, 50% of which are unintended. Young women aged 15 to 19 who want to avoid a pregnancy have much higher unmet need for modern contraception than all women of reproductive age who want to avoid a pregnancy. So 43% versus 24% for young women and girls. The effects of the COVID-19 pandemic on adolescent pregnancy in Latin America, for example, can be estimated at around 500,000 additional pregnancies, which could translate into social costs of $606.9 million US. The UNFPA Supplies Partnership supports adolescents and youth in principles and in practice, most importantly, through advocacy, supplies, method choice, comprehensive sexuality education, and data. So I welcome the support to countries in efforts to empower youth and provide quality youth responsive services. This support greatly contributes to the implementation of the UN Youth Strategy, Youth 2030, which fully recognizes the importance of youth leadership at the global, regional, and national levels and commits to expand young people's access to youth-friendly, rights-based sexual and reproductive health services, comprehensive sexuality education, and information. A well-resourced, resource-based, value-driven UNFPA Supplies Partnership is needed now more than ever. To build on its momentum and drive progress on the availability of reproductive and maternal health for the poorest women and girls, the estimated programmatic need is nearly $2.5 billion over the next decade. This need has to be fulfilled so that all adolescents and young people in all their diversity, young men, young women, LGBTIQ young people, are able to fulfill their potential and live lives free of violence and harmful practices, choose if, when, and who to marry, prevent unintended pregnancies, enjoy full rights and choices, and contribute effectively to their societies and communities. I call on all actors, and I count on all actors who are here and beyond to do their part in making this happen. Thank you very much.
Thank you so much for that, Your Excellency, and for really emphasizing on the inclusion and diversity angle as well. We thank you so much for your remarks. And I believe this is just the beginning of a very progressive, important conversation that is going to be ongoing from here on out. I have to say, on a personal level, as a mother, this is such an important conversation. But as a woman who's had access to choice, that's helped me be able to plan my life and be able to carry out responsibilities and go on to do incredible things because of choice. And that's why, on a personal level as well, it's something that I talk about very often on my own platforms, which is allowing the knowledge and access to contraceptives and family planning, because I've seen what it's done for me and for our incredible panelists who've spoken as well, and for countless others. So why not for the many who cannot access and afford? So this conversation is so important on those many levels. And with that, I really want to thank everyone who's joined this conversation from around the world, everybody who has participated, everybody who has taken the time to listen to our leaders make remarks and contributions. And hopefully that's planted a seed about what more you can do who's watching. It's not just for the leadership. It's not just policymakers. Each and every one of us has a responsibility and an opportunity to educate ourselves, to be able to educate others, and to be able to mobilize and be allies for the millions of girls, women, and boys and men who lack access to information, to be able to make decisions that can improve their lives. This global launch has just been the first step of our engagement for the new UNFPA Supplies Partnership. In 2021, the UNFPA Supplies Partnership will be deepening the engagement with partners and countries, and we want and must keep this conversation going with you so that we can drive progress together. Please continue to look out for any links that have been shared in the private chat. Please look out for the videos, look out for more information on this launch and the program that will follow. My name is Janet Mbogwa. It's been an absolute pleasure hosting you. Looking forward to being back for many more updates on what will certainly be saving grace and silver lining for many, many girls and women whose lives have been so deeply disrupted by not having access to choice. They deserve it, and the time is now. So thank you all. We will end this with our second partners video to be able to recognize the other partners who've been playing a role. Please continue chatting in the box as well. Once again, thank you so much for attending. I'm Janet Mbogwa. Have yourselves a great time ahead. Thank you.
The UNFPA Supplies Partnership is a and strategic partner for us in the region in order to make sure that young women have access to quality services and products, and is also able to answer a growing demand. The OPCU supports the UNFPA Supplies Partnership by building and supporting coalitions around citizens, researchers, youth, religious leaders, and governments to increase collaboration and coordination around supply chain management as well as advocate for funding for commodities in the 9 OP countries.
Our shared ambition with UNFPA is to strengthen health system supply chains, to increase the availability of essential medicines to women and girls. That is why we believe in the power and the potential of the UNFPA partnership. We will work with UNFPA and its partners to analyse health system networks, build capacity strengthening programs, and embed sustainable public health education programs at local universities. Help Logistics and the Kuna Foundation are excited and committed to the impact of the UNFPA partnership.
USAID has enjoyed a long-standing partnership with UNFPA. Together, as the two largest donors of family planning and reproductive health supplies, we have enabled millions of women and couples around the world to access their choice of high-quality and affordable contraceptives. And we've furthered our mutual objectives of sustainability and country ownership. We look forward to a continued partnership with UNFPA Supplies.
And I'm very proud to say that we've been the key partner of UNFPA supply program since 2012, and we have contributed more than 77 million so far. We intend to work with UNFPA to ensure that women and girls can freely and responsibly decide about their sexual and reproductive health.
1 in 4 women will have their demand met for contraception by MSI or an MSI-supported service in the countries where we work by 2030. This would not be possible without the partnership we have between UNFPA suppliers and national ministries of health. The partnership between MSI and UNFPA suppliers will help realize a future where no woman will die from unsafe abortion, unmet demand is met, and everyone can access reproductive choice freely and safely.